All right, welcome movement specialists to another episode of Triplane Function, where we're going to take a muscle, make it relevant to you so that you can see it, so you can feel it, so you can move it, and so that you can teach it. The goal of these videos is so that you can take this TheraBand and use it as a visual tool. This is not going to be an exercise, but it's a visual tool so you can learn and appreciate what your muscles are actually doing. Where we take these TheraBands, attach it roughly where the muscles really are in your body so that you can really learn how to see it, feel it, move it, and teach it. All right, today we're going to be doing your iliopsoas muscle. Your iliopsoas is actually two muscles, your iliacus and your psoas. They start from different points, but they come together and have a common attachment. So what you're going to do, please take your TheraBand. Don't be lazy at home. If you really want to feel it, you got to do this too. Tie a loop into it. If you need to, pause the video and come right back. Once you've done that, hold that loop in your left hand, wrap around the other end all the way around, and thread this end all the way through, Steve. Cinch it tight so that it starts to come out right at the center of your belly button. Now, your iliopsoas doesn't attach at your belly button, but for all intents and purposes, this is where you're going to really feel it. Anatomically, the psoas muscle attaches almost your entire lumbar spine, the vertebral bodies, L1, 2, 3, 4, and even above that on T12. It attaches to the transverse processes, so it's right outside of it on that same side, L1 through L5. It is a big muscle. You can't quite see it because it's hidden in your abdominal cavity, but it is a huge muscle that stabilizes the front of that spine. Some people call this muscle, along with the iliacus muscle, combine it. They term it your front butt. We know how big our back butt is. This muscle is also big. Just because it's hidden behind your intestines, don't forget that it's so big. The iliacus muscle is going to be right next to that psoas muscle. It actually sits within our pelvic cavity a little bit, in your ilium, and it comes forward. So this is why we have it where it is. Because this attachment of your hip flexor muscle is mostly to your low back, this has a huge effect at the low back. Steve, go ahead and face me. If I take his pseudo-iliopsoas muscle and I yank down and forward, because what does this do to his pelvis? It anteriorly rotates his pelvis. As he anteriorly rotates, he could be jamming up at this spine. That psoas is actually pulling those vertebral bodies even forward, which causes a bigger extension motion at this spine. A lot of people that have low back pain, a lot of arthritis, disc issues, if they're riding into a lot of extension, could it be due to some of these tight hip flexor muscles? Absolutely. All right, let's face forward. Let's face forward. Let's go ahead and take this end. This is where you can get a little bit friendly with yourself. Throw it between your legs, mostly on your right side, and wrap it around that right leg. Anatomically, the insertion distally to this is going to be in your lesser trochanter. And right before it attaches that lesser trochanter, there's a part of it that actually internally rotates. It twists a little bit before it attaches. Remember that internal rotation. That's going to be very important just in a few seconds. So, if you get a tug of this hip flexor muscle, someone that's a sprinter, or running uphill with this, this is where you can deal with a lot of FAI, femoral acetabular impingement. It throws off the kinematics, the movement of the ball and socket joint of your hip. So on one end you can get low back pain, another one you could be getting front hip pain. All right, what is this hip flexor commonly known for, the iliopsoas known for? I just gave it away. People call it the hip flexor because it indeed does flex the hip. Go ahead and lift up your right knee, Steve. You can even see, you can probably feel this on your own. I won't do this for you, Steve. You can feel how that TheraBand, as you bend that knee up, loosens a little bit. It concentrically contracts. Those muscle fibers pull together. Indeed, it does. The iliopsoas does flex the hip. Also, depending if it's going to be your iliacus or your psoas, it might AD duct the hip or AB duct the hip. And in the transverse plane, we know concentrically, because of that internal rotation slip, as it pulls, it'll pull that femur into this externally rotated position. Is that really what we want to train our hip flexors to do? To flex? They already do too much of that. If you are one of our sitting athletes, our desk jockeys, if you are a student sitting at a desk all day, this is for you. These hip flexors are known to be really dormant, to where they're going to be limiting you, causing hip pain, but more often than not, it causes some potential low back pain. We're going to go over how you get an effective stretch in this, which also correlates, and when we stretch, it's also the eccentric elongation of this from a strengthening aspect. Today, we're just going to be covering how you effectively stretch out your hip flexion muscles. Steve, show me, we'll use this Air-X pad here just for your knee. Show me how you can stretch out your iliopsoas muscle here. A lot of people.
Down. Just go forward.
Beautiful. Getting hip extension like this definitely elongates, stretches out this hip flexor. Why did I go through all the different attachments? Why do you care about that? We're going to take that useful information of where the muscle attaches so you can make it a much more effective stretch. So you get all three planes of motion involved, so the whole entire length, breadth, depth of this iliopsoas muscle gets stretched out. You can manipulate the variables first on what happens with this knee. Not only as he is bringing this knee backwards right here, getting hip extension, he can also move the knee out into abduction. So go and lift up that knee, bring it out. Some people, if they're really tight, and their psoas muscle will feel this stretch a whole lot more. Now, Steve, bring the knee inwards. Get more of an adduction motion. Some people feel this stretch a little bit more. One is not necessarily better than the other. It depends on what muscle might be more tight on you. Now, this is where that internal rotation component was that I mentioned earlier. Because that internal rotation slip, before it attaches to that lesser trochanter, I can really dial up this stretch if I take his femur through additional internal rotation. He's not giving me much. You can see he's almost falling over. I'm creating instability in him because he's already feeling a lot. So go ahead and bring that foot to the outside of you. That's going to produce the internal rotation motion of your hip. Just by this alone, you will be helping yourself be the movement specialist of your own body to figure out what stretch is the best for you. But this is only half the story. We have only been manipulating how this femur moves. Most of the attachments of this iliopsoas muscle is going to be in this lumbar spine, is going to be inside this ilium. What happens when we move this as well? So in the frontal plane, instead of just getting extension of this right knee, what if we get a little bit of flexion in this lumbar spine? Remember, when this psoas muscle drags you down, it's pulling this lumbar spine into extension. How do you get good flexion? Do a pelvic tilt for me. Tuck in those abs. Squeeze that butt. You might even feel a better stretch. Steve, what do you feel?
Feel a better stretch in front.
And as Steve just did that, he lost some of this internal rotation of this foot, of this hip. And he's almost falling over. Are you getting a lot better stretch there, Steve?
I'd say at least twice or 3 times better, yeah.
Awesome. If you're having a difficult time pelvic tilting, if you don't have the motor control that Steve has, you can also reach your hand up high in the air. You can feel this TheraBand probably even stretch out a little bit more, and you might even feel this hip flexor even more so than that TheraBand. This can help elongate, lift up that spine to get more sagittal plane length of this iliopsoas muscle. And once again, Steve can also manipulate the frontal plane by bending over to the right or bending over to the left. Now, depending on if it's the iliacus or psoas muscle that's tight, you might feel going right or left more than the other. Explore it. Feel it for yourself. Help yourself. Diagnose yourself. Which muscle is tight? This is really empowering. And last but not least, this transverse plane. I'm going to keep him internally rotated here at this foot, at this hip. And let's go and take this left-handed twist all the way here towards your left here. This is like a towel. I have wrung him up by internally rotating here. Bringing him up here. I'm dialing in a lot of transverse plane motion. He might be losing some of that pelvic tilt. So go ahead and pelvic tilt. Even reach your arms high up in the air. Steve, what do you feel here?
A really big stretch.
Good job, Steve. Good job. So with this, I hope that you can see what power this has to get an effective hip flexor stretch. You don't just purely stretch into extension. Don't get me wrong, that's a big component. Are you missing the other 5 variables to manipulate the hip and to manipulate the whole entire lumbar spine and pelvis? So through this video, I hope that not only could you see where this muscle was by using this TheraBand, that you could actually feel how this muscle can lengthen in all 3 planes of motion by having you go through these different variables of motion. Go out and teach it. Help a friend that has tight hip flexors. Help that person that's sitting way too long, that's getting that low back pain. You could change your life. Thanks once again for joining us in Triplane Function. We'll see you next time.